nutrition, physical health, for example, influence psychosocial well-being. And we are very focused on the socioeconomic and cultural determinants of health, and therefore we pay a great deal of attention to context. So I want to start by really reinforcing the incredible importance of early childhood. I mean, this is well established, but it's almost become an orthodoxy, I think, that detracts from the importance of adolescence, certainly in the health field, but also in developmental psychology and in many other disciplines as well. So here we have the prevalence of stunting in the Young Life sample at ages 1, 5, 8, 12 and 15 in each of our study countries. And you will see that starting in early childhood, children who are stunted, that you then see a very strong persistence of high rates of stunting, with boys more likely to be stunted than girls. Yet, one of the things that our study has found is there's considerable recovery and faltering in growth through adolescence. So this is a highly dynamic situation, not as we would have been led to believe in the past, that once you've passed the first 1,000 days of life, in a sense, if you're stunted, the cause is already lost for you. So we find that a significant number of our young people have actually recovered, and a significant number also who were not stunted have fallen into stunting. And the reason why this matters is because we can see that stunting is predictive of many aspects of children's lives. Stunting at age 8 is predictive of self-efficacy, self-esteem, and aspirations at age 12. And those who recovered by 15 had better cognitive test scores than those who remained stunted. So the really important point here is that early adolescence is therefore a dynamic and incredible critical moment of transition and a window of opportunity for policy. However, I think I would argue that we have very little systematic policy engagement with adolescents. Beyond the health field, health actually invented the concept of adolescence. It doesn't actually resonate in many other disciplines where research is being conducted. People talk about early, middle, and late childhood and youth, but not so much about adolescence. So we really need to raise the profile of this critical moment in the life course. I would also argue, though, that we lack knowledge, tools, and platforms for effective prevention. We do a lot of work with young people themselves, for instance, and not so much with their families and their communities. The resistors, the detractors, the people, the abusers and the exploiters often of children and young people. I just wanted to give a couple of examples from our data of ways in which adolescent health doesn't always threaten young people in ways that policy imagines. There's a very strong focus in the health community on risk behaviours, risk-taking, sexual reproductive health, and similar behavioural aspects of adolescent health. And yet we found that it was that these risk behaviours were so marginal in the lives of the 15-year-olds, we didn't continue with this work. We decided that this was not actually a productive area for research. However, we do find new health morbidities that have risen dramatically in our samples across the 4 countries. And perhaps many of you will be not at all surprised to realize that overweight and obesity is dramatically rising across the 2 samples. We can see how many more of the younger ones are facing these problems than were the older ones, but also we see it rising over the life course, including during early adolescence. So my main point is that young adolescents often lead complicated, demanding and unhealthy lives. These everyday realities are really important for shaping their health outcomes, not only in adolescence, but for in adulthood as well. So just starting with the daily time use, if you like, of young adolescents at the age of 12, we have nearly universal enrollment in education across the sample. That was an enormous surprise to us, especially in Ethiopia, which is a particularly poor country. Educational aspirations are extraordinarily high, and families make incredible sacrifices for their children to attend, including selling land, including getting into debt in order for their children to go to school. But education performance, learning outcomes are abysmal. The quality of education that most of the children in our sample receive is really, really poor. And this is particularly the case for boys, except in India, where there is a systematic bias against girls. In the other context, boys are struggling at school. And I notice that in the health community, people often talk about school as being the platform, the most obvious platform for young adolescents to access for their health information, health knowledge and programs. But actually, school can be a really distressing experience, not just because it's humiliating to repeat your grades and to fall behind your peers, but also because it's a very violent and hostile place. For girls, for example, going to school during menstruation is often impossible because there are no private toilets for them to attend. Corporal punishment and bullying are really pervasive phenomena in all of our contexts. And then I want to turn to work. I think the Western world tends to imagine that adolescence is a time free of responsibility when young people are all in school. Well, they aren't. They're in school part-time in the main, and when they're not in school, they are working very hard. And here you can see two examples from Ethiopia and Vietnam, where you can see that the amount of hours spent a day working rises over the course of adolescence. And of course, there's a big distinction based on gender between boys who do more paid work and girls who do more of the domestic work in the home. That's not a surprise. I think, though, that I want to highlight this combination of school, work, caring for sick family members. You know, most of our young people have responsibilities, not just towards younger siblings, but in contexts like Ethiopia, where adult health is so compromised by so many different conditions, they're often actually caring for their elderly parents, their grandparents, and indeed they're sometimes the primary breadwinners. So they struggle to meet both the immediate needs of their households as well as those incredibly high aspirations for the future. And those aspirations are not just for individual social mobility, but also the family rests all of its ambitions on the future of their children. So early departure from school, which is very common amongst the children who work, is a source of terrible shame and a terrible sense of stigma that follows. And those aspirations that were high when they were in early adolescence crash as they leave school. They repeat their grades, they fail their exam, they don't transition, and they realize that they're not going to realize their future hopes. And yet, we can't take work away from adolescence. It's really important as a learning vital gender skills for labour market entry. It's a way you get the toe in the door, as it were, and also for contributing to households. So this is the reality of everyday lives for adolescents across many parts of the globe. And here you have a quote from one of the caregivers in Ethiopia who's talking about her 12-year-old son. And she's really proud that he's got a job. She's really proud that he's working in actually probably quite a hazardous occupation, because this is enabling him to learn skills for his future. So I just really want to reinforce this argument that poverty, risk, and responsibility are really important in shaping the trajectories of young people. And we can see how the multiple determinants of household poverty, environmental stresses, shocks, of individual struggles that young people face in going through school and so on, impact their outcomes. Predictors of secondary school completion and early marriage and parenting are already well established in early childhood. And we need to understand that this is a source of social injustice and inequality in many contexts, where young people are not able to get themselves out of this extraordinarily difficult situation they find themselves in. So just to finalize, I really wanted to emphasize some of the policy messages that I would like to convey from our evidence. We would argue that, yes, the first 1,000 days of life are absolutely critical, Of course, we must emphasise that. However, we've got to find ways of linking investment and policy across childhood and adolescence, and not just assume that young people are in school and in school they're catered for, because that's absolutely not the case. We need to have adolescent-sensitive social protection programs which enable young people to have more choices and to alleviate the pressures on their lives. Cash transfers and other programs have found to be very effective in many communities for taking some of the load off families and therefore off their young people as well. I really want to advocate for a holistic understanding of adolescent health, which goes beyond risk behaviours and much more towards competency and resilience. They are, in the main, extraordinarily competent young people. They take extraordinary responsibility. Let's not take away from that by making them victims and pathologising their lives. School environments, we need to have real attention to sanitation, safety and respect for young people, and not just focus on curriculum. We need to have much more attention to occupational health for young people, because they really are working very hard in often very dangerous conditions. And let's design interventions that actually match young adolescents' real lives. Thank you.
Richie, let me welcome you to the stage.
Thank you, Bob. We just changed our slot a bit.